it. Over for the governmental call.
Okay, please pay attention here. I'm going to ask that everybody put their phones on mute until it's time to talk. And when anybody is talking, everybody else have your phone on mute. With that, I would like to welcome everybody to this special meeting of the Humboldt County Board of Supervisors, Thursday, March 26th. I just want to say before we kick off that in accordance with Executive Order N2920, the March 26, 2020 Board of Supervisors meeting will be held virtually. So public comment may be submitted by email, and that email is cob@co.humboldt.ca.us. Again, that's cob@co.humboldt.ca.us. Also, throughout the meeting, if there's an agenda item on the agenda that you wish to speak on, you can contact the clerk of the board at 476-2390. That's 476-2390. Thank you very much, and we will get your messages through the clerk of the board to the Board of Supervisors when they come in to us with a slight delay. With that, I am opening the meeting, and I'd like you to join me in a salute to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Since we are having this meeting virtually, we do have another member of the board joining us via phone, so we're going to do a roll call of board members.
So, roll call, Supervisor Bass. Here. Supervisor Madrone.
Supervisor Madrone might want to take your phone off mute. Supervisor Madrone? Okay.
Is the phone on?
The phone is on. Yep. Everything's up.
Mic on? Mic on?
Yep, mic's on.
Okay. Supervisor Fennell.
Here.
Supervisor Bone.
Physically, yes.
Supervisor Wilson.
Back from quarantine, here I am.
So we have a quorum, and if there is some kind of technical glitch, we will make sure that Supervisor Madrone joins us as soon as possible, and we will let you know when he has joined us. So with that, Madam CAO, any modifications to the agenda?
There are no modifications to the agenda.
Now, I'm going to be moving the schedule around a little bit because we have a time-certain item, and that is from the Public Health Department. We have our health officer, Dr. Frankovich, and Michelle Stevens, who is the Health Department Director. So are you both there? Again? Okay, we're good. Hello?
They were all there.
And now they're all gone?
Yeah.
Okay, so I'm going to just take a brief 5 minutes, and we'll get that technical issue taken care of.
The consent calendar.
Thank you.
Estelle. Could we, as we try to work that out, or part of the COVID team is here, from OES is here, why don't we have them present so we can get them back to doing what they need to do, OES and...
Sure, we can add that as part of the Public Health Department COVID response thing. So yeah, let's go do that, and we'll try and get the doctor. Thank you very much, Supervisor Bond. So we'll have Sheriff Hansel and Ryan Derby. Welcome, and thank you so much for all that you are doing.
Good afternoon. I appreciate the board meeting today to discuss this and the votes that they're going to take place today to support this ordinance. So as 20th, we've been in a local emergency regarding public health issues here relating to COVID-19. And the Emergency Operations Center is up and running to support this public health emergency. We have personnel assigned. We have an incident commander. And the full ICS system is operational. So how that works here in the county in a declared emergency is that we work with the cities and the tribes to facilitate the needs for this emergency. So things that are related to this specific emergency can be requested to go through our Emergency Operations Center to facilitate the logistics, the procurement, the financing, and the tracking of this emergency. This emergency is going to be very, very expensive in the end, and so it's very, very important that we track these expenses to get reimbursement. As of right now, the state, as we know it, the state has declared an emergency, and also the federal government has declared an emergency. And so in the future, we will be coming back and requesting that this county requests emergency funds as a part of that state and federal declaration. As of right now, I want our Incident Commander Ryan Derby to give a report out on what specifically is occurring at the OES and how we are supporting this emergency through public health.
Thank you, Sheriff. Welcome, Ryan.
Thank you. Good afternoon. So right now we have a level 2 activation that's a medium level.
Is that on?
I think your mic needs to come on there.
Okay. User error. Okay, you're back on the meeting. Okay.
There, good.
I have no idea.
So right now, the EOC, or Emergency Operations Center, is activated at a level 2. That is a mid-level activation.
You know what? Are they on?
Yes.
Ryan, I am so sorry.
That's okay.
We're in the middle of an emergency, but as I understand, Dr. Frankovich actually has a conference call at 2 o'clock, so I think we're going to go directly to the health officers first, if you don't mind.
I don't at all.
And if you can wait, we're looking forward to hearing back from you. Thank you. So with that, Dr. Frankovich, welcome to the Humboldt County Board of Supervisors special meeting. We're looking forward to your update.
And I'm sorry, because I wasn't sure when things cut out. Did you hear any of what I had said? No. Okay, then. We'll start over.
And before you begin, can you hear me now? This is Supervisor Madrone.
Yes, hi. Thank you.
Thank you, Supervisor Madrone. I'm glad you're back and joining with us. And if you wouldn't mind to mute your phone at this point, we'll be taking a presentation from Dr. Frankovich and Michelle Stevens.
Thank you very much.
Thank you. Go ahead, Doctor.
Yeah, so this is Dr. Frankovich. We have, just as a status report overall, we have had 54,000 plus patients in the country confirmed with COVID-19, with 737 deaths as of last evening. All 50 states are now reporting COVID infection, as some of us may be watching closely. In our local area, we have had a total of 154 tested, with additional testing being done today. 154 tested through our lab, with 10 confirmed cases. We also have a total of 129 negative, 66 pending tests, and 1 positive from commercial labs. As everyone knows, we had a jump in cases in the last day or so. These reflected largely travel and individuals returning to our community from travel elsewhere. We also have an individual where it is not clear yet whether it is a community transmission case. If so, it would be our first. But we are still doing the case investigation and trying to identify if there may have been contact with a known case. So we will update everyone as soon as we know that. We are still pushing for testing in the community, encouraging providers to submit tests. Not only are we testing high-risk groups in terms of contact and in terms of travel, but we are also testing individuals who are in high-risk groups, those who are individuals who work in healthcare, first response, who are residents of nursing home facilities. Any of those instances are encouraged, as well as hospitalized patients, because they are a priority for local testing. In addition, we are asking providers to, if in their assessment the patient is presenting with symptoms consistent with COVID, if they have clinical concerns, we will accept those specimens until we exceed our capacity. So I think the providers are increasing what is being sent in, and that's good for all of us. The testing, while it is not as expansive as everybody would like, I know, including us here in public health, I do want to point out that we are actually more than twice exceeding the national rate of testing per population, and we are actually far exceeding the California rate as well. And I attribute a lot of that to the presence of our local public health lab and how hard they're working, as well as the availability of the commercial labs and our provider community who is getting tests out the door. And I think that helps us all in terms of situational awareness as this outbreak continues. I did want to mention, because I know there have been some questions from the public on this about the travelers returning from, and the media release that we put out regarding itineraries. I've heard questions about individuals asking about why they weren't individually notified about their presence on that flight. And what I would tell everyone is that there's a system in place in which we contact a federal agency that is able to get passenger lists so that we can individually contact passengers. In practice, this operation is slow. And I suspect because of COVID, it's even slower. And because we could not get any confirmation that we would have a passenger list in a short period of time, we went ahead and did the media release so that people could self-identify. It's not perfect, but it was incredibly important that people were able to have that information in their hands as soon as possible. And I'd like to point out that at this time, I still do not have a passenger list, so we are really happy that we moved ahead and did that without having it in hand. Trying to think what else the board might need updating on at this time, or if you'd like to turn to questions.
So, Doctor, there are quite a few questions, and if you're open at this point, I would like to point out to the people attending the meeting via either watching on Humboldt Access or watching on the internet, that if you send in questions, there'll be about a bit of a minute lag time. We'll get the questions to the clerk of the board, and he will read them out for us. So again, the email address is co.humboldt.ca.us, or you can call 476-2390. One of the questions that I have gotten for quite a number of people, Dr. Frankovich, is what kind of information can we release about positive cases and where they're from? Now, I know that we talk a lot about privacy, but people are concerned to know if the positive cases were from one or other area of the county. Is it possible for you to do that?
And I'm sorry, it's a little difficult to hear, but I believe you're asking about whether we're able to identify where in the county individuals reside. Is that the question?
That's correct.
Yeah, so again, as we spoke about with our initial case back in February, we released information that is personal information as it relates to investigation. So if there is a reason that we need to identify people who the contact may not be able to identify, or the case may not be able to identify as a contact, that's when more information is put out. At this time, there is no more risk to the community in one town versus another related to a case, so identifying the individual at that level is not needed. We are, however, having the ability to have first responders and such alerted to, at the time, they may need to intersect with a household of someone who has COVID so that they're aware. But there is no need at this time for the general population to have particular awareness of where an individual is residing. And in the effort to protect confidentiality, we do not give that information out.
Thank you. Anyone from Supervisor Bone has a question?
Dr. Frankovich, as far as the 3 planes that you're trying to get the passengers list, are we fully using the law enforcement personnel we have to track that down just as if it was a criminal case? I mean, not that it is, but just to relieve, because I know I got a call from somebody that was on that plane and they hadn't been contacted yet. And so I had told them to contact you. But if we use LE personnel and Billy's here and I don't, maybe he can't, I don't know. But I know they've had to do this before on criminal cases, on smuggling cases. I know we've done this before. And I know you've got staff also, but this working together, you might be able to expedite this and actually have, that way somebody doesn't fall through the cracks or say, well, I guess they haven't called me, I guess I'm fine.
Sure. Well, and the sheriff and I have discussed this, but I do want to communicate that in discussions, for instance, with airport operations, they do not receive passenger lists and have no way to access that. Their mechanism is the same as ours, which is sending this request through the federal agency, and I believe it's DGMQ, and they actually have to contact the airlines and have the airlines assemble and get back to them with those lists. If there is another route available that's expedient, that would be helpful. And as I said, the sheriff and I are discussing that.
All right, and I'm just going to toss it out.
Of any alternative route that actually would be able to identify that information in a timely way, and that's why we do. At this point, I'm moving to doing these releases because we can do it quickly.
I'm fully aware, and I appreciate that, but I think somebody that has all passenger lists is Homeland Security, and I'm sure we have a great working relationship with them here and at the San Francisco office. So I think to expedite, however we want to say it, I think to basically get our answers, they are fully on board during this pandemic, and I think that might be a shortcut. I don't know. I'm not a detective. I'm not a health official.
Right.
I'm just trying to throw that out there because I know they have the passenger lists.
Yeah, and I get that. I mean, we're in conversations with the California Department of Public Health to explore all options too. As of this date, I've sort of been told there is no other way to access this, but of course we'll be exploring any options that might be available as we move forward because it's possible we'll have additional individuals return.
So, well, this is a policy making venue, so I'm going to toss out a couple of ideas that have been talked about. I talked with Director Mattson earlier today. What about the idea of having a team of health people or one person meet each plane and interface with the people arriving, advise them on what their problems are in terms of whether or not they need to quarantine, and also ask them questions about where they've come from, as well as at that point you would have a list of everybody who'd been on that plane.
Well, I think, and again, I apologize, but it's the voices are very wobbled on this, so it's a little bit hard to hear. If you're asking about us receiving people at the airport and screening them, is that the question?
Yeah. So I'm going to speak direct. I'm going to speak directly into the phone here. Maybe you can hear a little bit better, Doctor. So the question is, having personnel meet the plane and going through a list, as has been done with the motor pool, asking them where they've been, if they've been in contact with anybody who's been exposed, advising them that we have a shelter in place in operation, and those kind of things, and then also getting their name. That way, if there were any eventuality, we would have that list of passengers.
Mm-hmm. Yeah, I mean, it's certainly a thought, Supervisor. What we have been talking about, obviously, the issue of people coming in, for instance, from plane travel is that at this point, there are very few places I would consider low risk or a passenger coming in from that area being low risk because of the additional airports they've had to go through. So, in reality, I consider everybody coming off that plane as sort of being a potential exposure in some fashion, really. And the recommendation I have made is that those individuals all should be returning from travel, should be quarantining for 14 days under the current circumstances that we're sitting in. There are sometimes different provisions around the issues of essential workers and healthcare workforce. But I think that we can certainly to do sort of screening of all passengers and personally inform them about what they need to do would be possible, but labor intensive for sure. I also think we have talked about making sure that there is lots of information at the airport posted and available that explains to individuals about our shelter in place, explains to them that the need to be monitoring themselves for symptoms and quarantining and sort of additional bullets like that, which that's something we can put in place kind of as a right-of-way move. In addition, we're telling everyone that non-essential travel should not be happening. And while, it is not in our purview to not have airport operations, and we actually do need those in place, we do want people to be using them for appropriate purposes.
Thank you, Dr.
The EOC can look at that suggestion.
Sheriff Hansel.
Yeah. So we are looking at that right now. We've talked about that in our policy group, and we will be developing a information packet and also signage that will be at the airport that will greet every person that comes off that plane. And so we will have proper notice of what their recommendations are from the public health director directly given to them.
Great, thank you. Supervisor Bass.
Thank you, Madam Chair. And I'm just curious, and maybe people would refuse to sign, but there are not that many planes coming in now. I know 4 people that were in that travel group that I know of at this point. So I mean, this is in my little conversations over the last day and a half. But why is there a reason we can't ask people for their name and even just name and contact information so we know who's on the plane? Why do we? I'm just kind of going. I may not know Homeland Security, but to me, if there's one plane coming, it seems like there should be a way we could more easily identify. But I know Supervisor Bone may have something to add.
No. I hear you, Supervisor Bass, because when I first had this idea tossed, it was like you had this idea that we were at the airport and they'd be there all day. But we have, 1 or 2 planes come in, and with maybe 5 or 6 people on the plane, I don't know that it would be that heavy a lift to greet and get those names and keep it confidential for health purposes.
I think before we probably do that, has anybody got on a plane? What is San Francisco doing? Because I know San Francisco is handing out flyers saying if you're traveling from here, essential air, doing all these other things, and it basically all we're doing is asking for a bill of lading with passengers' names on it, which seems to me right now there's nobody here, but we should have one of our airport, have Cody or somebody follow up with, can we get this every day? This is not protected information. Mm-hmm. So we should be able to get that who's coming into our county. We're not reinventing the wheel. We're all hearing this, mm-hmm. But the thing is, it's getting that name 4 days later, or whenever we get it, the horses are out. We're shutting the gate. We are telling people know if they're coming off a plane, they have to be quarantined if they're coming from certain areas. It's just like our shelter in place. If people aren't minding it, then it's falling on deaf ears. Yep. Not deaf, just people won't listen.
Yep. Okay, are there any other questions from the board or comments for Dr. Frankovich? Supervisor Wilson?
Well, I guess my concern is, if it's focusing on the airport, are the bus systems still running in terms of Amtrak and Greyhound? And if so, there should be no reason why we wouldn't have the same protocols for that. And to understand that really most people traveling into Humboldt County are still coming by individual cars, and many of them in groups. And so, I mean, I understand the anxiety about one particular port of entry and what it's caused in terms of the numbers that we've seen in the last couple of days. But, you know, to be realistic about, you know, the breadth at which we're able to do these types of things. And I know there's even been folks talking about, you know, border patrols and other things like that. And there are some conversations to talk about that. And I think maybe Sheriff can address that. I will say that I am thankful that Public Health did put out those things about asking people, because I had someone call me who said, someone just called me and said, weren't you on that plane? And then they, they had already called Public Health themselves and had registered themselves and started into that process. And so it was successful, at least for this one person, I assume others. And so I'm thankful that we were able to do that. And I do want to reiterate too that, you know, we get a lot of questions about the testing rate, which is abysmal nationwide, but it is good to know that we're twice the rate of the rest of the nation and in terms per capita, as well as higher than other places in California. Although, you know, we're all have a huge amount of anxiety about the lack of testing, and certainly there's going to be long-standing discussions about that at a national level. But for now, I'm grateful that that our personnel are able to get the testing that we're able to get done, and I'm hopeful we'll get more. So that's what I have for now. Oh, and I had one more question, which will be, there's been a lot of questions about masks in the community, their function, and I want to kind of make sure that that's also on the docket for discussion.
Dr. Frankovich, do you want to address either of those? I know that the sheriff also would probably want to say.
Would you like me to address the issue about masks?
Yes.
I think, you know, there are really two levels of issues there. One is the personal protective equipment, including masks that healthcare workers, you know, first responders, those types of individuals need to have access to. Those are, as everyone knows, I think, in both nationally and the state, are in short supply. We are fortunate to have, you know, supplies on hand now for that purpose, but there is absolutely no way in which there are enough of these sort of N95 or even surgical masks for the population at large. Also, you know, again, just by CDC recommendation, masking in general for healthy population is not a standing recommendation. And, you know, although certainly I understand people wanting to do that, and I don't think there's any problem with people doing that, one thing I would say is that if people are ill, they obviously should be staying home and not coughing and, you know, sneezing all over. But if they are out and about in public and they want to wear, for instance, a fabric mask that I know these are being constructed, they can certainly do that. But I do want to remind people that part of the issue with masking is that it is not only important that the mask be in place if you're using it, but that you handle it appropriately, because masks that become damp with sneezing or coughing, or masks that are being handled all day by, you know, as people are touching things and handling their masks, you know, it gives people a false sense of reassurance, I think, that the mask is providing protection and also that it's decreasing transmission. If the mask isn't functioning properly, it doesn't give you a whole lot of protection. And if you're handling the mask or the mask is soiled and you're touching things, that can be a problem as well. So if people put a mask on, they need to put a clean mask on. They need to not handle it while it's on. And if it's wet or has been soiled, it needs to be cleaned for everyone's sake.
I think that's, thank you for asking that question, Supervisor Wilson, because that's been on a lot of people's minds. And anybody who's, you know, stuck at home and looking at the internet all day long are seeing all sorts of remedies out there and all sorts of theories about if you wear the mask, you won't share your droplets aside from sneezing, even when you're talking. What about that? And
I think those masks can be helpful for large droplets and that type of thing. And I think as we go forward, you know, again, I certainly understand that need. It'd be great if people are able to use measures that assist them. So I just want to make sure that if people are doing that they really do take into account using it appropriately.
Thank you. So are there any other questions for the board? Otherwise, I'll open it up to public comment.
Yeah, this is Supervisor Madrone.
Oh, sorry. Please excuse me, Supervisor Madrone. Please go ahead.
It's all right. Good conversation. And first, I want to start out by thanking Dr. Frankovich and all of our health workers for all the incredible work you're all doing, as well as all the other emergency responders in the whole system. Thank you, everybody. So in regards to traveling, it concerns me about flights coming in and stuff too, but I agree that people are coming in from all directions in cars, buses, and there's no way to really control that. We certainly don't have any policy say over any of that at the board. Although what I do think is that as we get people to take it more seriously in terms of self-quarantine themselves or staying at home, sheltering in place, and these things, then that's what we need to focus on. And so I'd like to hear more about that, but my thoughts on the mask are much like what you were saying, that it's not a safeguard, and it's really important that people treat it carefully, sanitarily, and do all the right things with it, and not be buying the surgical masks and N95s. Leave those for the healthcare workers. And if you have a supply of them out there that you over-purchased on, please donate them to local health departments, et cetera. But I do think that as a board, one of the things I'm hoping we're going to do today is maybe be coming up with a list of some policy directions we might want to ask staff to come back to us with at the very next meeting, whenever that will be, to provide some direction in regards to those areas where the board can weigh in, because I know my constituents, your constituents are all asking us to do more. And again, doing more doesn't mean we haven't been doing everything we can. I think we're doing a great job, but I think we can do more. And I think encouraging, maybe having a voluntary policy of encouraging people that if they absolutely need to go out for essential services, wear a mask that you've, and it starts sending a message that this is serious, folks, and we all need to be participating. So I see some very good positives from that. But at any rate.
Yeah, and I was going to mention in response to your issue about the sheltering in place and that being in part a control measure in terms of returning travelers, and I really want to reiterate that. The shelter in place is a huge undertaking, and it is critically important as we watch areas around the country going through this. It can have a profound impact on how quickly this infection spreads within a community. And so I honestly cannot emphasize enough to people that if we want to dampen this curve on the pandemic, to not have, our health system compromised by a large number of patients being ill at one time, the social distancing, the sheltering in place, the lack of travel is all critically important. And everybody has to contribute to that effort. People not taking that seriously are really not only endangering themselves, but the rest of the community. And I take that very seriously.
Hey.
I'm sorry, I do have to get off. I'm sorry for another call, I believe.
Is there any way that you can just hold on 1 second? Let's see. We have a number of questions from the public. Clerk of the board, if you can't stay, could Michelle, perhaps? Doctor? Oh, she's gone.
I'm sorry.
Oh, yeah, okay, good. If you can't stay, could Michelle help us enter any health questions?
I believe the call might have been pushed back. If Sheriff Hansel is in the room or Ryan Derby is in the room, I believe it was pushed back to 3 now, and if that's the case, then we can stay on.
Oh, perfect, great.
Yes, the call's been pushed back to 3.
Great.
Supervisor Fennell.
Okay, great.
Supervisor
Thank
Fennell.
you. Yes.
Yep.
Supervisor Baker.
Madam Chair, may I ask one more question, please?
Certainly. Go ahead, Supervisor Madrone.
Thank you very much. Dr. Frankovich, I know there's also been a lot of talk about short-term rentals, and I know that's a big thing in our Trinidad area, where some of the companies are actually advertising for people out of the area to come and stay here. And yes, they say something like, and then we advise you to quarantine for 14 days, but I do know that there's a need for housing for out of the area doctors, healthcare workers, and others that are going to help take care of people. But it seems to me, and I know the community up here, that we could require that these rental places require some proof that they are in the healthcare service industry versus just people come from out of the area. That actually concerns me even more than the airport part, but I just wanted to get your take on that. Is there a way we can set a policy that is enforceable? Because I know the sheriff has concerns about that as well, which I totally understand. But somehow we need to split the hairs here on a few things and come up with a few policy recommendations.
Yeah, I agree, and you're right. We've been in discussions about this as well. I think that that balancing piece is having housing available for Humboldt residents as well as essential workers coming in to the area, such as locums medical providers. So we have to retain that availability, but at the same time, I am completely with you that this is not a tourist destination right now, and that we really do need to be able to limit people arriving here simply for non-essential purposes. So I am working on developing some language on that. And of course, we're ongoing looking at the ordinance as it was released and whether we need to make any changes to that as well around various issues of response. So I can tell you that we'll keep you updated on that, but it's certainly a concern on all of our radars.
Thank you.
Thank you both. Supervisor Bone?
As Supervisor Madrone, I think everybody knows how much we appreciate everything everybody's doing. I think we need to thank our public out there, because if I'm doing the math right, we have 10 people, maybe more today, I don't know. 7 are from one group. So that means we've been doing a pretty good job on community spread, and I think that needs to be recognized. With that, there are some people out there taking advantage of a situation, and I've said this from day one, if you have to ask, and I hate the term essential, but if you have to ask if you're essential, you're not. If you have to ask. And I mean, that's kind of brutal, but as I said earlier, Stephen Curry and LeBron James and Madison Bumgarner are at home, they're not essential either. So don't take that as offense. This is just for your safety. This is just for your health. But remember, we are doing the job. It looks like these are travelers. So you guys take this serious, and we're going to get through this quicker.
Absolutely. So we'll take some questions from the public right now. We have clerk of the board, Kathy Hayes.
Good afternoon. We actually have several comments. Tracy will be making some of them.
Turn it on, please, babe. You could sit down at the table if you wanted, Kathy.
I think it's going now.
Okay, good.
Okay. First public comment comes from a gentleman by the name of Thomas Mulder. Mr. Mulder is asking a question: why are we not providing something for businesses and the community to stay afloat, rather than making and putting out a community tip line and protecting the community first? This is something that he apparently observed related comments on Facebook. So,
thank you for that. We definitely have a robust program going for businesses.
I think if you roll down from the tip line, and you will see our economic development department has about 6 people over there through the SBC, Redwood Region Economic Development Center. Everybody out there is an economic line for you to call to help your business and the avenues to do that. With that being said, being 7 days into this, or less than 7 days into this, they're not handing out bags of cash yet, but they are setting you up to be ready for that. So as the sheriff said, we have to make sure that we write everything down so we can cover our expenses. For you small businesses, I ask you, document all your lost revenues, comparably speaking, just like you would for your taxes. And don't forget, if you have loss of product, keep track of that. It looks like the feds and states are going to be well into $3 trillion trying to make you, and it doesn't look like they're going to make you whole, but they're going to try to make you healthy. So in turn, follow go to our COVID-19, HUMCO COVID, and there is some great, it's hitting everything along with Humboldt Health Alert, but there are some great financial and business tips on there with a tip line for you to call.
And Sheriff, did you want to address that at all? No, I think we did great. Thank you. So next question,
The
please.
second comment comes to your board from Kate Whithouse, the Chief Executive Officer for the Northern California Community Blood Bank, and this is an extremely important statement that I'm going to read into the record.
Can you get closer to the mic, please, Kathy?
The Northern California Community Blood Bank is the blood provider for Humboldt County hospitals. As you are likely aware, COVID-19 response efforts are having an effect on the blood supply both locally and nationally. Blood donations is an essential activity, as the need for blood for hospital patients will not go away over the coming weeks and months. We have many decades of experience maintaining a healthy clinic environment and following strict infection control protocols. We have taken additional safety measures to intensify cleaning and disinfecting and minimizing donor crowding. Our focus is on sustaining collections over the coming weeks and months as the spread of disease and increasing quarantine measures make more of our population ineligible or unwilling to give blood. The blood supply must be considered during any healthcare related emergency planning activities. Additionally, I would urge you, as prominent community partners and spokespeople for the healthcare community, to help emphasize the need for healthy individuals to donate blood in your public statements and communications. Thank you. Kate Whithouse, Chief Executive Officer, Northern California Community Blood Bank.
Thank you, Kathy. Dr. Frankovich, do you want to weigh in on that a little bit, please? Oh,
I'm sorry. Again, the acoustics are a little difficult. I clearly heard the comment about blood banking, and I do strongly encourage people to donate. It is considered an essential service, and it is needed. So if there were some additional questions in there, if somebody can relay those to me.
No, there were no questions. It was basically a statement of the importance of the blood supply and also the ability they have to screen people, that they've always been able to do that. So thank you. Next question or comment.
Okay, the next comment comes from Kent Sawowski. This is his statement. My wife and I left our house this morning at 7 a.m. We appreciated early shopping at Winco and Costco. We wore our 3M 821 N95 masks. We used social distancing, and we used hand sanitizer. Only about 2 to 5% of the employees wore masks or bandanas. No one in the pharmacy area was wearing them, and that's the first place that sick people go. Why? I spoke with a supervisor about screening at the airports. I was told that there was sufficient screening in place at LA, SFO, and larger airport, and that the 70-year-old deputy working at the airport wasn't capable of doing this type of screening. What part of the $200 million DHHS budget could be used for this type of screening? How did the lack of screening work for us in Humboldt? Why is HSU busing in students from LA and San Francisco and airports? For the unconscionable who went to Spain and then who did not come back in self-quarantine. Thanks for endangering our citizens, especially the elders. Is this the result of THC impairment? Take your weed, your greed, and may the Lord bless you and keep you away from us.
That's Ken Sawowski.
I have one more that was emailed.
Tracy.
Okay, the next one is emailed in from Cindy Ashe. And she says, do you know where exactly the 10 confirmed cases of the coronavirus live? What part of our large county, and where are they shopping for groceries and other places that they may have been? I'm immune compromised, and this is very important information that I would like to know, and I'm sure that others would like to know as well. I'm trying like hell not to catch this thing. I can't even move or get the medical care I need because of it. Can you ask the health officer to please release more information that would be helpful to us so that we can avoid increasing our risks? This is a small county population with a large geography. If the health department releases more information, we might actually have a chance of protecting most of the people. But the lack of information is making it much worse. Reading through the LOCO comments, Los Coast Outpost comments, I don't think that I'm the only one who's thinking about this. Can something please be done?
Thank you, Tracy.
If you'd like me to respond.
Yes, please.
On this issue, I completely understand people's worry and concern, but I do want to reinforce that individuals who are either contacts of a case or are a case themselves are not able to be out shopping and doing those activities outside the home. They are inside their home. And so there's, for those individuals who are concerned about being out and about, again, cases are in isolation, asymptomatic individuals are in quarantine, and they are not circulating in the community.
Thank you, Dr. Frankovich. Supervisor Bass.
Thank you, Madam Chair. And Dr. Frankovich, I think what people are, I hear what you're saying, but I don't think there's a real comfort level thinking that everybody who's been exposed is already isolating. Obviously, some people, they don't feel well for a few days, then they get tested. I think people are more concerned about where were they before they got a positive test, you know? So I hear what you're saying, but what can we do to ease the comfort level of people who wonder, well, where were they shopping right before they got the results?
Well, what I would tell you is every individual who is identified as a case triggers a case investigation in which we are looking for everywhere they've been and who they've been in contact with during the period that they're considered infectious. And so that investigation happens, and we reach out to individuals and, if appropriate, to establishments if there's a concern. So that does happen with all of these. But what I would also say is, again, one of the reasons for the shelter in place in general is because we know that, you know, even low levels of community circulation can occur before we can become aware of that by laboratory testing. And so we all have to act as if that is really already occurring in our community, in the sense that we all need to be, again, limiting our activities outside the home, using the good and frequent hand washing, staying home when we're ill, and we've given people very specific guidance about that. Whether or not they know they've been exposed to COVID, if they're experiencing fever or respiratory symptoms, they should be at home. And they should be at home until 3 days after the absence of fever without using any medication. And it's been at least 7 days since the onset of their symptoms, and their symptoms are improving. That is the measure used by CDC and CDPH to help ensure that people are not circulating in the community when they're in their infectious period. But it relies on everybody's compliance because, again, not everyone is going to be tested, and not everyone is encouraged to go in for medical care if they have mild respiratory symptoms.
Thank you, Doctor. So we don't have any further public comment, and I'll bring it back to the board. We do have some department heads, et cetera, in here. Is there anybody else who has any questions or comments for the doctor? Seeing none, I want to thank you very much, Doctor, and if you want to stay on the line, we would be very happy to have you. I do want to go back to Ryan Derby now, who's heading up our Emergency Operations Center. Supervisor Bone?
Well, I'm thinking we do have department heads here who would probably like to get back to what they're doing. Not that Ryan wouldn't either, but can we just get a brief view from the department heads that are here so they can actually go back quickly? Or because I think Ryan and the sheriff are going to take a little bit of time, whereas, I mean, just a suggestion, I'm just.
Supervisor Bone, we have another item on the agenda that I think that the staff members are probably interested in. So I think I'm going to stick with this agenda item right now and hear from the COVID-19 EOC. Welcome, Ryan.
Thank you. I'll keep this fairly brief. I just want to go over a couple of our priorities downstairs in the EOC and a brief overview of what our sections are doing. So we've been working very closely with public health, specifically with the public information through our Joint Information Center. Our number one priority is ongoing public health and safety. So the key part of that is the public adhering to the guidance in the order. And a lot of that is reliant on compliance, because many of the things addressed in that order, we don't want to send people out to be cited. To the sheriff's point, it's educational enforcement. So ongoing public health and safety relies on the public. Our second priority is ensuring accurate and timely information both for the public and for our other operational area partners, cities, tribes, members of the board, arming people with information on what they can do to protect themselves and better prepare for this. And number three is continuity of government. So we're seeing people staying home because they're not in an essential class, but we still have a duty to make sure that we're providing for our public and responding to this incident in a way that protects them. So our logistics section is currently working on acquiring PPE, or personal protective equipment, and working on distribution plans both for healthcare and first responder agencies to include fire, EMS, and law enforcement. We got a shipment in yesterday of close to 70,000 N95 masks, which will begin distribution tomorrow. That's going to be outfitting, local cities, tribes, special service districts, and the county with PPE. And to the point that we had earlier about public using PPE, we want to make sure that we're reserving those for the sectors that need it, those that are having contact with infectious people, those that are doing apprehensions out in the field, and those that are responding to homes of people that are calling in ill. Another thing that our logistics section is doing is acquiring hygiene supplies for field personnel to include hand sanitizer, recognizing that the number one guidance is hand washing, but those that are working out in the field can't do that. So all of these supplies are in short supply right now, but we are seeing some local businesses that are creating hand sanitizer or diverting manufacturing to develop these products. So we are encouraging our local OA partners or operational area partners to reach out to us for support, but we're also providing them some of those networks so they can reach out and get the supplies themselves through their own emergency operations center, their own logistics section. Our planning section, we have staffed an advanced planning unit that is currently working on creating modeling to determine local impact to the healthcare system. They've created a surge matrix that offers some suggestions for the surge response. I think the numbers that I saw this morning, somewhere in the ballpark of an estimated 5,000 surge impact, or 5,000 people into the hospital. So we know that's going to overwhelm our healthcare system. And through creating this surge matrix, it's allowing us to pre-plan and pre-stage some supplies and personnel and determine how we're going to respond to that if and when the impact hits. Our planning section is also creating daily situation reports and incident action plans that we are distributing out to operational area stakeholders. Those reports are updated daily with current case counts. It includes event closures, school closures, and major distribution plans for this PPE that's coming in. Our operations section, we have a volunteer coordination unit that is staffed up working with local community emergency response teams, or CERT teams, for the distribution of this PPE. Also included into our operations section is the public health response. So the communicable disease unit that's working on the contact tracing for those that come into contact with infected individuals, And then, of course, the lab testing that's occurring daily. We also have the economic development team that was alluded to earlier, so thank you for that, Supervisor Bone. And the COVID compliance line, 707-441-3022, that was instituted yesterday to allow residents and businesses to call in with concerns about compliance. So again, compliance with this order is on the individual, and if there are concerns about compliance in the public, I encourage you to call that number, and people are monitoring that daily. And lastly, our finance section, working very hard to track personnel and procurement costs, keeping very detailed document records for potential reimbursement in the future. That concludes my report.
Any questions for Ryan? Supervisor Bass?
Thank you, Madam Chair. And I'm not sure if Ryan's the best one to answer this, but the compliance line that I saw, and the number and what you just read, I think it comes at a good time. I can't speak for the others, but I'm getting multiple messages about, my workplace is not taking this seriously. I don't feel safe going to work. And then I think about, there's no real compliance. I don't know what we are allowed to force in someone's workplace. And so where would be the appropriate place for someone who has concerns about practices in their workplace to go? Tip line, they could probably get it, because I don't know if it's really a compliance or if it's something, okay, does that sound?
Might be just educational.
Well, that's what, because I'm wondering what we're doing with people that have offices that do, let's say, care providers or something, that they have a group of them. So I guess I'm thinking about bars and things that are easy to do compliance for. I wasn't really thinking about people's workplace.
So I would refer them to the tip line, and the people that are monitoring that line are compiling a daily report that we'll be sending out to all local law enforcement, and recognizing that the order is based on educational compliance or educational enforcement. It's going to be up to the discretion of those local jurisdictions how they want to handle those.
So if this is in the city of Eureka, they'd still call that same tip line.
Yes, and
we'll diverts it to the right place.
That report and push it forward to Eureka Police Department. I think the key thing is inside a business, adhering to what's set forth in that order and trying to adhere to the social distancing as much as possible. We recognize that that's not going to be possible everywhere. Even down in the EOC, we have 30 people down there, but we're taking on a certain level of risk that we're recognizing that the greater impact is getting ahead of this response. So for essential businesses, trying to follow that order as much as they can and following the CDC and CDPH guidelines as best they can. That's all we can really ask for.
Thank you.
Sheriff?
So this anonymous tip line, it's used for us to invite a conversation. And I was just talking to Director Ford, and we're going to try to incorporate code enforcement officers as well to go out as compliance checks to follow up on that. It doesn't take a badge and a gun to go out there and do this. It's just a warning. We have warning letters. I was talking to the other chiefs this morning, and only 2 citations have been issued in the whole county, and those for individuals that have been out after dark, essentially, just wandering. And so it hasn't been for any businesses. Businesses overall have been very, very compliant. But as we get through and get more into this event, then the tolerance will be less and less. And we will issue citations to those businesses that aren't in compliance. Now, there's some people that just don't want to show up to work because the fear that they may be exposed, okay? We have no control over that. That's between their and their employer. If they're a part of essential business and they, are part of delivering that service, and their employer requires them to work, and they're healthy, then they need to work. Otherwise, then, there's nothing we can do about that. That's between them and their employer. But we're out there. We take this serious. We're documenting everything and sending out that information to the cities and the county to make sure we're following up on all that.
So I know that you've had calls about bars, et cetera, and as you exercise the educational component, what kind of response are you getting from people that you actually go and talk with?
So far, it's been good. Some people have been disappointed, right? But it's good,
Okay.
overall. You know, we are trying to get information out as best we can through a lot of different means. We have reshaped our website, the Humboldt County website. If you go to the main Humboldt County webpage, humboldtgov.org, you're going to see our COVID information right there, and that'll direct you to Humboldt Health Alert page. We also have a Facebook page that's pushing out messages, and a Twitter, and also Instagram, and that's the Humco COVID-19. And so if you Google that, you'll be able to get the latest information, or go to our main webpage and get the latest information on this.
No, I've been noticing that it's really, really, really helpful.
And I just want to add one more thing to the Board of Supervisors, and we are going to equip you more with information, because what we want is we want you to be the spokesman out there for us. We understand that you all are connected in your districts, and we want you to be out there more armed with information. So we're working with the CAO and our JIC to provide you essential information, and we're going to be pushing you out there more for us to educate the community on what we're asking.
Thank you, Sheriff. Supervisor Bass, then Supervisor Bone.
And this is probably a simple yes, but we are coordinating with all the 7 cities also on that, correctly?
So regarding what?
The talking points going out, because you're talking, you want us to be the spokespeople. I'm just wondering, like general, my district is much of the city of Eureka, so should I be getting their talking points, or should I be?
So that's your district. We're going to give you the information. What you do with it.
Okay, good. I just didn't know it was gonna. I just want it to be the same. That's why I figure you guys are coordinating with the cities.
So as a part of our JIC, we are pushing information out. It's the same information that everyone else will have, but we will give you that information so you are armed with those specifics.
Okay. Are the cities or someone representing the cities involved in the JIC, the Joint Information Center? I'm just curious.
Yeah, so there's representatives both in the Emergency Operations Center. We have Eureka Police representatives, we have Humboldt Bay Fire, we have CAL FIRE personnel, numerous county employees there. So we've spread the love in our EOC as well as the JIC. We have Humboldt Bay Fire representatives, county employees from all departments there. So as, again, we start going through this emergency, we're going to start asking for more from the cities, more from the state in certain classifications. And I just want to remind the board as well, even though we have a lot of county employees that aren't at work right now, and we're still delivering those essential services and responding to the emergency. So a lot of people are wondering, well, where is the homeless outreach that you used to do 3 weeks ago? The fact is that we have to reprioritize a lot of what we do to respond to this emergency. So people have to understand that there are changes in services that the county has to make in order to prioritize responding to this emergency. So that's what we're doing right now. We're prioritizing lots of things, like what to do with homeless right now, what to do with the aging population, those vulnerable groups, how do we feed them, how are we working with the schools. Humboldt County Office of Education has been a great partner in all this, and they continue to be. And so we want to continue to do these kind of things, but it takes reduction in our normal services in order to deliver, because we don't have a bullpen here. We don't have people to bring in other than our normal staff. And so since this is a statewide emergency, when we send the message out, hey, we need help, guess what? Everyone says, yeah, we do too.
I guess all I'm asking, thank you, Madam Chair, for letting me continue to that last piece. If you want us to be the spokespeople, I get a lot of emails from certain city council members who are really concerned, and you just touched on some of the concerns. And without me having those talking points, it has been really hard. Then I have to send it off to Connie, and Connie has a conversation. So, that's all I'm asking is to try to take some of it off your plate. If we can have some of the information we need, that would be really helpful.
We recognize that, Supervisor Bass. Absolutely, we want to do that, because you're the one that's built that relationship with those city partners, and so we want to make sure that you have that information so you can be the spokesman and deliver that on point. So that is our goal. Just so you know as well, is we have 3 meetings a week, no, 2 or 3, with the tribal, 2 with tribes and city entities. Phone call, that's what was supposed to be at 2, now is at 3. Mm-hmm. And then we have 2 meetings a week with law enforcement representatives. So we're touching base with the cities essentially 4 times a week, as well as lots of phone calls and follow-ups for clarifying the information. So we're staying connected. But like we're experiencing, the cities are also experiencing. They don't have a whole lot of personnel to give and provide right now because they're dealing with their own emergency.
It just seemed, then going to Supervisor Bone, it just occurs to me as I'm listening to the conversation, we have probably double the workload and half the team. And that's what people have to keep in mind, is we are keeping the county running as we're addressing this emergency as well. So give us a break if not everything is being addressed right when you need it. Supervisor Baum.
And I think, like I said, we're 6 days into this thing, 7 days tomorrow, and we need all the answers right now. It's not going to happen. I think our DHHS department is doing everything, and I think my last phone call to Connie Beck was at 9:30 last night regarding homeless issues. Now remember, 7 days into this, our homeless issue hasn't changed. It's our need seems to have changed, because now we need to house our homeless, but we need to house them 6 feet apart in an area where they won't commingle, and so it gets a little bit difficult, and they have people working on that. We've got people out in the field, but some of them have been brought back in. It may seem like they're not doing enough, but I think Supervisor Fennell just hit the nail on the head. They are doing a lot more with less, as we are trying to keep our employees just as safe as we're trying to keep you, our citizens. So as we go through this, all of this can be if we follow the guidelines. And 6 feet, wash, sanitize. Ryan, thank you for hitting up. We do have 4 liquor distributors, or 4 distillers here, licensed local distillers, making sanitizers. They put a stop on everything and are making sanitizers to the tune of 100 gallons at a shot. Remember when this is all over, because some of that most of it, I guess they're donating it. One of the grain companies down in Woodland donated a bunch of grain to one of the distillers because of this thing. So all I can say is use their sanitizer now, buy their whiskey when it's over. Let's be fair, because we're going to have to recover from this. The other thing is, people call us and we refer to Dr. Frankovich. I refer to Ryan. I refer to Billy for answers. People don't like the answer that I relay to them, so they say, aren't you their boss? We work with these people. We are in a position to put experts in the position to answer the questions. If you don't like the answer, I can't change it, because that's why we put these people, Dr. Frankovich, Sheriff Hansel, Ryan, in the positions they are, because they have been all over to be trained on this. COVID-19, no, it's our first time, yeehaw. But let's rely on the experts. Let's do what's right. I can't say it enough. Let's do what's right and what they say, and we're going to get through this.
Sheriff.
If I could just chime in on that. Thank you, Supervisor Bone, and for the Board of Supervisors here that just all recognize. I see your heads nodding up and down, because that's exactly right. We all want to do something in this circumstance. We really do. And the board has been very attentive and wanting to pass, whatever they possibly can to help mitigate this local emergency. And yet, it is our responsibility, Dr. Frankovich and her direction, Connie Beck, our office running the EOC, working with the medical community to try and combat this. We are the subject matter experts here, that we are working and to inform the public and inform this legislative body here to what's the best avenue. And so we're going to be giving you more stuff in the next week or so to possibly change this ordinance and to vote upon and try and get the influence you're giving us also helps us shape our policy. And that is our goal. The Disaster Council together shaping policy to inform the EOC director, myself, the IC manager, the public health director, so we can actually handle and manage this emergency. So thank you.
That's one of the reasons I'm somewhat reluctant to change policy at the next meeting, or maybe the meeting after that, because we don't know where the hell we're going with this. So to enact policy before we get to the end of it, or closer to the end, to know what we're setting policy for, I think would be reckless, and probably a pretty good staff time consumption. And you just heard we have half the staff. So do we need to do what we think is right, or will this work? Let's make a policy. Let's wait till we need to know what our experts say, what the policy needs to change to. And I know that we're seeing other counties around us changing theirs. you know, and it's not like we're not looking at changing things, but we've got to make, it's not the idea of doing something, it's the idea of doing the right thing.
I would just chime into that. You know, what we're seeing it across the whole globe, and we can take our messages from the measures that other people have taken, but we have a very solid ICS system, and that's what we're operating under now. And I think that it's working really, really well, and I want to commend everybody I've been working with. It's been great. And you have to learn, as part of the ICS system, you have to learn when to step back, and you have to learn when to listen. And I think we're all doing really, really well, and I thank you so much. Ryan, is there anything else that you wanted to add on there? I have one more question, but I want to ask you if you have anything else.
I don't. I just want to thank you all for putting your trust into our department, into our EOC. We do have some very highly trained and dedicated people working down there, and it's good to know that we have support.
So my question is, you said that we got 70,000 N95s. I just wondered, how long will that last? I mean, what does it cover all of the emergency responders and all of the healthcare workers?
So what we're looking at right now is a weekly or bi-weekly distribution in an effort to conserve that level. I was on a conference call yesterday with the state, and it sounds like there's several million N95 masks that are coming into the state of California. So there may be an opportunity for us to put in another resource request and acquire more when we need it. But the last thing that I want to do is take that away from a community that has a higher impact than we do right now. Right. So in an effort to conserve masks, again, I'm going to put it out to the public, don't use N95s if you don't need to, because we have healthcare workers, we have first responders that need that equipment. And we will work out a distribution plan that will conserve those, and we're calculating, you know, what the daily burn rate is and what the response rate is to try and make that last as long as we can.
So for an emergency responder, healthcare worker, I mean, these actually were used by construction workers up until this. How long can they use it? I mean, is it something they can use repeatedly, or?
If a mask comes in contact with anyone that is considered infectious or exposed, it's a one-time use with an N95 or a surgical mask. So it's one time with an infectious disease. Now, if it was something like dust or wildfire smoke, we can use it more than once, but in this circumstance, one and done.
Okay, great, thank you. Supervisor Bone?
And I think this is, as mad as this may sound just like toilet paper, but we have so many people ramped up 24/7 making the masks, other distributions that weren't making the masks. I think we're going to get to an even keel here within, 10 to 20 days, even though we have more, because there are so many masks coming in. I know one local distributor has pallets of sanitizer coming in, and masks soon to follow. So I think we're seeing that. And again, I want to reiterate, and we talked about it, is there have been an outpouring of support from a lot of our private contractors, local people. I got a call on one Sunday that donated a bunch of stuff, would not take any money for it because they wanted to do their part. And so I want to thank Linda Sellers for that, without calling out everybody, but I'm just saying, I thought it was pretty touching. But you also had a lot of donations of 10 and 20 masks here, there. So people are stepping up. We're asking the contractors that have a backlog. But a lot of our contractors don't keep cases of these things around. But there are people stepping up. But I think we're going to see a leveling out, even though as this picks up. So I think just use them as sparsely, as little as you need, especially if you're not a frontline responder.
Thank you.
If I may, on the note of donations, we're not seeking spontaneous donations at this time. Just with this order in effect, we don't know where the virus is, right? So we don't know what equipment, what supplies have come in contact with what. So at this time, we recognize people want to help, and we appreciate the help, but at this time we do not want supply donations.
Thank you, Ron.
Outside of vetted sources. Yeah.
So I would be remiss if I didn't see if Supervisor Madrone didn't have a question. Do you have any question or comment for Ryan Derby? Okay, well, thank you Supervisor Wilson?
Well, it's not so much of a question as just a reiteration of the concept that we are a political body, and that in both by ordinance and by this California Constitution, there's a separation to these professionals in that give us the advice, the community, the direction that we use. We don't. I don't think we don't want to live in a society, in a community where we, as the political arm of things, are giving direction to our professional class of people who are actually doing the job of giving us that good advice. I want people to understand that all of us are receiving the comments and the suggestions that we're getting from our community, and we are forwarding them to those folks who are making those decisions to make sure that there's no stone unturned in this, but giving direction specifically about health advice is something that is, we may have opinions about that, but we really want to make sure that the professionals have that ability to be supported in the decisions that they're making. So I just wanted to clarify that. And please, everybody in the public who has comments, opinions, and questions, don't stop bringing those to us. Understand that this is, that we filter those, or we give those, we don't filter them, but we give those and get those responses back from the people who are best equipped. And they also, I want to reiterate that our public health officials and our OES are not doing this in a vacuum. They are connected every day with the state and federal authorities, as well as their peers, especially in the field, and that information is aggregated twice daily at least. And I want to make sure that people understand that this information is flowing rapidly. Thanks.
Thank you for underlining that, Supervisor Wilson.
Supervisor Fennell?
Absolutely.
Just to add on to that, what Supervisor Wilson was saying, if you go on to the COVID-19 line, to that site, there is an FAQ, frequently asked question, that they update, because you guys, and I think we have to say, we're not going to get through this without your guys' ideas too. I'm not saying we have the experts that are know-it-alls. We have experts that know a lot. But we also have a very unique county that has a lot of very, very smart people that are willing to do the work and give us those same information. So we are passing off that information. And as Supervisor Wilson said, we're passing it all on. And then we're letting them decipher, what was worked. And then that's being worked into, and every couple of days adding to the frequently asked questions if it hasn't been answered, both by our health official, both by our OES office and our sheriff, and getting your answers out there. So before, sometimes a lot of these questions, earlier we had a question about economic development, what are you going to do to make us whole? That's on the COVID line. We don't just have a tip line, we have the COVID line on there, and an economic development is running it with quite a few economic people with a lot of help from other agencies. So as this is going on, we are trying to put as much information as we can to put in your hands, because as we all know, and it's been mentioned in a couple meetings, our health is important, and economic stress can cause a lot of that. So there is avenues for you to do this, but you're going to have to do a little work. I've said it over and over. Nobody's going to hand out bags of cash. You're going to say, hey, I need this to be made whole. This is why your argument's going to be made. So that the COVID line and the Humboldt Health Alert are both great sources, and I think that's a good thing to fall back on.
Supervisor Wilson?
And I want to reiterate, too, that I have had many constituents that have offered information, ideas, and those sort of things. And I want to let people know that there have been changes based on that information that's come in. But I want to say that we are all beta testing a new reality. Everybody is beta testing this situation, and I want to reiterate that our citizens have been, for the most part, for me anyway, positive team members in that process, and that they are understanding and cognizant of the the strain and the stresses that the situation is creating, but also that new systems are being created by the day, and that I want personally, I know others too, that feedback is really important and and appreciated. And so I just wanted to thank our staff at every level for being open to those, to all of that information that's coming in. And there's also some unsung heroes in the IT departments everywhere across all the nation in terms of trying to talk about beta testing new stuff. I mean, those of us who have been working a lot from home and understanding, Skype and Zoom and call-ins and all that stuff. I mean, there is a team of IT people at every level, at every agency, and every workplace that are like probably sleepless trying to figure this out, and I want to put a shout out to them too, because
it's kind of the way you talk about that. It kind of reminds me like this hive mentality. The whole county is working together, teamwork. The whole country is working together.
Hopefully.
If you go into any particular restaurant or whatever, order out, everybody's got a different method, but they're all accomplishing the same thing. So thank you very much.
May I make a comment, please?
Yes, please.
I really appreciate the conversation and all the work that Ryan and the team and Sheriff and his team are doing. What I want to know for myself as a board member is, where can we help the sheriff? Where can we help the health officer? Where can we help the community in setting policy, direction, and guidelines to the best of our ability to help give more comfort to our community about issues that we all know are out there? So that's really where I'm at, and that's our main role, is setting policy.
Good afternoon, Supervisor Madrone, Sheriff Hansel. Number one, I want to say thank you to you and the rest of the board for passing on those concerns and those messages from your constituents. It's very important that we hear from your constituents and what the pulse of the community is and the questions that they have, because if one person has a question, probably 1,000 people have the same question. So you funneling those questions and Madam CAO for passing those on at times and is very, very essential for us to continue with our messaging and shaping our FAQs every day, essentially. What you can do is what I said earlier, is continue that public messaging. We're going to be supplying you with information, and we want you to be out in the public and being our representatives in pushing the message and ensuring that message gets out there. And also, having that sense of calm that needs to be over this community. This is quite scary for a lot of people. And, at this time, this is our government's time to step up and show that we can lead this county and lead our people through this. And we can. And we're going to come out better and stronger through this, stronger as a community. But we need our leaders and our county to step up and show that we can do this and we can handle it. But we all need to work together to make sure that this gets accomplished.
Yeah, we each have a role. Thank you, Sheriff.
And at the end of the day, I sit up here and I think I'd be remiss if I didn't say it, because I hear it a lot. This is, as Supervisor Wilson said, this is a new world for us. And we're adapting to it and figuring it out and everything else. Take a minute and get down on one knee and explain it to your kids, because this has to be really confusing for them. Mom and dad are home. Mom and dad are freaked out. Why are mom and dad freaked out? Did I do something wrong? And this is they're going to be able to say, God, I remember that a little bit. I mean, we have seniors in high school that can't graduate. They're going to do fine. They're going to do fine. But those young kids, make sure you sit down and explain to them what's going on. And with all the doom and gloom and mom and dad talking about, do you see how many people died in New York? Do you see how many people died in Colorado? Do you see how many people died there? You guys are talking about death around a whole bunch of little kids, and that's kind of freaky. So I think it's time to maybe go out and play catch with the kids, tell them everything's going to be fine, and it's time to be that parent they need right there and then. And I'm sure everybody is, but don't overlook your children, because they're kind of freaking out too, and they don't have the knowledge or the wherewithal to balance that out like a lot of us are. So, I mean, and I think Mike just spent some time at home with, you know, so I mean, this is tough time. So why all this is going on, remember your family, remember your kids, because that's a really, I mean, I haven't seen my grandkids in 14 days. I talked to a guy this morning, he hadn't seen his in 18 days, because we're being careful, and it's tough. But I think, kind of let the kids know, I'm talking to them every day, but let them know what's going on, you guys.
Thank you very much, Supervisor Baum. Any further discussion on this item? Sheriff Hansel?
Just one message to the millennials out there. I saw this, online the other day, that your parents, grandparents, and great-grandparents were called to war. You're being called to stay home. Stay home. Okay?
Thank you, Sheriff. Wise words indeed. Thank you. And thank you very much, Ryan.
Thank you.
So that will take us to our next item. And I don't know if...
I believe that there's a motion being requested to accept the report. I make that motion.
Nice.
We have a motion and a second. I will do a roll call.
Roll call vote. Supervisor Bass?
Yes.
Supervisor Madrone?
Yes.
Supervisor Fennel?
Yes.
Supervisor Bone? Yes. Supervisor Wilson?
Yes.
5-0.
Thank you, Ryan. So that will bring us back to the top of the page here. And do we want to do the consent first? Yeah. Okay, so let's go to the consent agenda. There are a number of items on there. We already ascertained there are no changes to that.
I move that we approve the consent calendar.
Second.
Any discussion or public comment on the consent? Okay, we do have public comment on consent, and Ryan will give us that. Well, Tracy's bringing it in. Okay. So just to fill you in on this, what we're doing is we're taking public comment on every item, but it takes about a minute or so to get that information and to get it into the room. So we'll wait for Tracy, and I will remind people that we were hoping to have video conferencing for this particular meeting. We have almost gotten it together, so any other meetings coming up during this emergency, we probably will have video conferencing. So we have a public comment on the consent agenda.
So this public comment is from Kent Sawowski on...
Sorry.
Kent Sawowski is taking a different look. I mean,
right? I told him I wasn't going to make any of his facial gestures. So, on C2, he would like to express his appreciation to Tina, who is a great realtor, and for all the many things that she does. And today he would like to thank her for the service on the Assessment Appeals Board. And C3, he would like to point out that this position could soon be one of the most important and busiest in the next few years. Being in real estate for over 46 years, it is apparent to myself and others that Humboldt County property values are susceptible to the value suppression. Under current economic situations, values could drop 50 to 75% from their high. Pot properties have already taken a major hit. Even an individual who is naive enough to buy a $2 million permitted grow at today's prices is likely to see that property drop to $200,000 or $400,000 in value over the next few years. Property owners should even now appeal where tax values are lower than assessed taxes. Isn't the difference between $1 million or $2 million valuation over $10,000 over taxation per year? On C15, I support this. According to the staff report, she has 7 years experience as a public defender and is willing to accept the interim appointment. I was unaware of the absence of the current public defender and always recommending appointed qualified, willing staff versus taking the chance on hiring outside. How did that work out the last time for the public defender or the HR director? The budget difference is $13,345 per month. Is the current public defender on paid administration leave, like the current county counsel who has been for over a year? Just curious. P.S. Please allow the public to Skype these comments in. Therefore, doing your due diligence to allow public comment in these meetings and to meet with the Brown Act requirements.
Thank you. Any other public comment? Seeing none, I'll bring it back to the board. And as I just referenced while we were kind of filling time here, we are actually working on Zoom and Skype and everything. And hopefully by the next time we meet during this emergency, we will have video conferencing available. Supervisor Bass.
Well, Madam Chair, I believe the Brown Act has been amended a couple of different times to allow for this. And actually, I think we're doing more than probably a lot of other boards. So I appreciate the concerns about the Brown Act, and thankfully with CSAC and others, you know, that we're talking with the governor, we have seen changes to make it this type of thing possible. So I don't want anyone to say or to think that we are not following the Brown Act.
No. Agreed 100%. We're following it very closely. So with no further comment on the consent agenda, we'll have again a roll call.
Roll call vote. Supervisor Bass?
Yes.
Supervisor Madrone?
Yes.
Supervisor Fennell?
Yes.
Supervisor Bone? Supervisor Wilson?
Yes.
5-0.
Thank you. And that will now, thank you, Trace. That will now bring us on to our department reports. We have one from the County Administrative Officer, considerations relating to updated employee procedures, policies, and emergency signing authority, a memorandum of understanding with the Humboldt County Office of Education, all in response to the COVID-19 pandemic emergency.
Thank you. Before your board today are considerations related to employee policies, emergency signing authority, and an MOU with HCOE. A few of the significant considerations contained in the resolution include essential functions, disaster service workers. Staff recommends that employees who do not have an assignment should be placed on paid administrative leave until such time that their supervisor identifies work or they are utilized as a disaster service worker. Departments have every intention to have county employees work wherever possible during this emergency. However, while on administrative leave, county employees are still to remain designated disaster service workers, and department heads, supervisors, and human resources will look for ways to reassign them. Staff may be reassigned to the Office of Emergency Services for unfilled needs or to do some other essential function. Overtime, there are provisions in the county's overarching salary resolution and the HDSO Law Enforcement Management Unit regarding overtime for county staff, including management and confidential employees and law enforcement, for cash compensation for overtime in emergencies. Under normal circumstances, MNC and LEM employees are not eligible for overtime. However, those employees who are assigned to duties specifically related to this emergency or any emergency, such as being assigned to the EOC or the Joint Information Center, will earn cash compensation for the amount of overtime worked during the emergency. Your board may choose to modify the salary resolution as it relates to MNC in order to appropriately address the COVID-19 local emergency. Your board may not alter the MOU with LEM at this time. The salary resolution specifically excludes department heads for being eligible from overtime. Signature authority for department heads. During this emergency, departments will need to execute contracts in order to procure items and services, receive funding, and for other activities related to county business or this emergency. Often departments receive state standard agreements that cannot be modified to accommodate local ordinances and would go before your board on the consent agenda. The attached resolution allows department heads or designees thereof to execute agreements related to a declared emergency with the requirement that such agreements must be ratified by the Board of Supervisors at the next available board meeting. It is also recommended that your board approve an agreement between the county and HCOE for the use of their conference center for the county to operate the emergency operations and joint information command centers, as these particular functions have outgrown the spaces that they are currently in due to the magnitude of this emergency. In addition, we are asking for your board to also direct the Human Resources Director to develop and implement procedures to track and assign disaster service workers to county functions. And that concludes the staff report.
Thank you very much, C.A. Nielsen. Any questions or comments from the board on this item? Supervisor Wilson?
I have none other than to thank the staff for putting this all together under these trying circumstances, and I move that we approve staff recommendations.
Second.
Okay, so with no comments from the board, are there any comments from staff? Oh, sorry, Supervisor Bone. You're too far away.
Yeah, because that's what we're supposed to be.
I know, but it's over.
So, as we get into this, I don't know about anybody else. We're getting a lot of calls from employees going, am I essential or am I non-essential? Am I going to get PPE to be in my office? Is there a way we could stagger people? Because I know there's offices that there's stuff that could be done where you could put 2 people in a whole office, and there is stuff to be done, or 3 people, so it's done safely. But if we're going to give, and is there a limit on admin leave? I mean, if this, heaven forbid, goes 4, 5, 6 months, is there a point with the new unemployment rules? Are we going to have employees coming to us going because they're going to get their unemployment for 4 months plus $600? I mean, I'm looking at what the president's come out with, and if it's more beneficial for them to be laid off rather than follow admin leave. I mean, there's a lot of questions still out there to throw out there, and I'm just making sure that we have all of this. And I mean, I'm looking at the breakdown of cost per month of what this could be and where we're at. So I'm just, is there some of the things we talked about earlier? I mean, just to pass it this quick, this is a big financial thing, and it's a big thing for our employees. So, and I would love to, and I can't believe there's no comments from their union reps or any of them asking, good, bad, or indifferent from just what we've heard. So.
Okay, so there were a number of questions.
There was.
So let me start off by saying, in your resolution, the first item in the resolution is to encourage staff to work remotely when feasible and focus on core business activities. When continuous remote work is not possible, separating staff by offsetting shift hours or days and/or social distancing is encouraged to allow government functions to continue. So yes, offsetting shifts is encouraged, offsetting days, social distancing. So absolutely, departments can implement those processes and procedures. Is there a limit to paid admin leave? So for those county employees that are currently non-essential, let me step back for a second. The Department of Homeland Security and the State Department of Public Health have both released information on critical infrastructure and essential workers. And so there's a pretty healthy, robust list of who is essential. And so a great number of county functions are essential core services. And so for those few non-essential services that the county does operate, those employees will be placed on admin leave, but they're also will be designated as disaster service workers. Human Resources will maintain a list of those disaster service workers, and those disaster service workers will be placed into other functions. And so they will hopefully not be on paid admin leave for a long period of time. In fact, hopefully it'll be relatively short. The EOC, the Joint Information Center, my office, Human Resources, we are in desperate need of additional assistance right now because the workload is so monumental. You also talked about just laying folks off because President Trump has offered an additional unemployment benefit of about $600. And what I would say to that is there is a complicated process to lay off a government employee, and that is not something that we would take lightly, and not something that we're currently looking at because, quite frankly, we need all hands on deck right now because there's a lot of services that we need to provide to the community in order to help the community get through our very first terrible pandemic that we are currently experiencing.
I love that line.
In addition, I would also, I did have to throw that in there,
I know.
yes. So in addition, I do want to add that, yes, this is going to be a costly event for government, and one of the things that we do is that we do track all of our costs related to this event, and hopefully we will be reimbursed by the state and federal government for those additional costs, particularly those folks that are working in the EOC and the JIC and receiving overtime that is part of this resolution for your MNC and LEM staff. AFSCME staff already receive overtime. So hopefully those costs would be reimbursed, and while we would pay them up front, hopefully on the back end we'll receive reimbursement.
And I'm not questioning any of that. It's just, these were all questions that I had been given to me, and I just wanted clarification because this is a pretty big nut item. And just to say, yep, let's go. Not that I fully don't trust my experts. I had to ask. Thank you.
No, Supervisor Bass?
Thank you, Madam Chair. I was just, when the CIO is mentioning, getting the money back from the states and the feds, I always get concerned because aren't we still waiting for dollars for roads from disasters in the past? And
No kidding.
Yeah, that's way past due. So is there, what can you?
So yes, that is a true statement, and I will say that the state and federal governments have been much more active with this particular event, and some of those funds are already starting to filter down. So I'm a little bit more optimistic this round.
Well, these are dedicated funds, so to COVID-19. So I think that's. And with that, I think people need to know we are not just saying, oh, work like hell, we're going to get paid back or get the overtime. I think we're doing it as diligently as possible because we're doing it with a limited force.
Exactly, and thank you. I want to say this whole package is just proof of the amount of work that has been done in the last few days by the administrative office and all of the department heads, and I just can't say enough about your diligence in getting this together in the first in any of our lifetimes and our parents' lifetimes as well. So yeah, CAO Nielsen.
And I just want to add that it isn't just the county administrative office.
No.
All department heads have provided some input, and human resources and county council have been a fantastic partner in putting these employee related policies together. And so I just really genuinely appreciate the teamwork that's happening right now.
Supervisor Wilson?
And I want to focus a little bit on the part where, every county employee is, a public employee, and that, in my experience, virtually everybody understands their role in helping to hold civil society together. And in this time, it's more important than ever. And that flexibility to give people a role in that, because that's really what they're used to doing all the time anyway. And certainly allowing and having the opportunity to be able to have function in that is, I think, really important. I have had some employees tell me that they're actually really glad they have something to do that's functionally, that's helping our community, and this is the kind of flexibility that allows that to occur, and I do appreciate that very much. And all of this is within the understanding that everybody who is working in these sectors has their own issues at home related to kids not being in school, and relatives that need to be taken care of, and all that other stuff too. And I appreciate that flexibility in there and the hard work, and so that's why I was so eager to jump on this and ask that we approve.
Fully agree. It's like summer vacation.
Supervisor Madrone, do you have anything to add to this discussion?
No, I appreciate all the comments.
Thank you. Any public comment or department heads who want to weigh in on this? Okay. Welcome.
Excuse me, Madam Chair.
Yes, yes, Supervisor Madrone.
Yeah, I apologize. After this item, I see there's nothing really left in the agenda, and I would like to ask that we have a little bit more discussion about a couple of follow-up items and the future schedule for meetings. A couple of items, if we can, please. Before we adjourn, because it may be a week or more before we get together.
It'll have to be asked
I
if
have
it's
to-
not on the agenda.
If it's on the agenda, if it's not on the agenda, we have to, I would be happy to add it to, add anything different to an upcoming agenda, whichever meeting we have next, either a special or a regular.
Please clarify for me, maybe Madam CAO or someone else. I was simply going to offer up some suggestions for staff direction without actually taking action on anything, just some direction for items for the future. But if you think it's best just to come to you to do that, I'll defer to your preference, Madam.
I'll ask County Council to give us a weigh in on that. And CAO Nilsson?
Supervisor Madrone, are you asking to provide input onto the employee policy?
No, that's why I brought it up now, because I see this is the last item on the agenda, and I didn't want to just adjourn without being able to get that thought in. Being far away on the phone, it's, when do you jump in, right?
So may I ask what you want to provide direction on?
Yeah, certainly. I just wanted to, first of all, it's not about this item, and so if we want to finish this item, and then I'll take a minute or so to explain, that'd be fine.
I think that's probably the way we're going to go, Supervisor Madrone, but I'll ask Council Billingsley to clarify about the agenda, and I will offer that anything that you have on your mind, we can talk about it and get it on the next available agenda. Council Billingsley.
Yes, Chair. I would just say that I don't know that it's appropriate to have a discussion to give staff direction, but I believe you could have a brief discussion. If you want something agendized for the next meeting, you could say what it is, as long as you don't talk about what that direction is, and you could decide that you want something on the next agenda.
Great. Thank you so much.
Could we also just direct that to staff with a phone call?
Okay, great. All right. Welcome, Kelly. Kelly.
Thank you. Good afternoon, Supervisors. Kelly Barnes, Interim Human Resources Director. I just wanted to thank you for your support as well. We really appreciate it. There has been this great sense of teamwork within our agency to move all of this forward daily. And I think all of our colleagues here, too, that are helping kind of support this event moving forward as it does keep kind of evolving and all of the questions coming in and trying to support our departments and our employees as best as possible. So I really do appreciate your support and the communication that's taken place. We are working very closely with our unions also and trying to communicate with them as best as we can, especially with time-sensitive items. So we're definitely keeping those communications open and will continue to, as well as they're communicating directly with us about concerns that are coming in as well. So again, just wanted to thank you.
Thank you very much, Kelly. Appreciate all of the hard work that you guys are putting into this. We can repeat it many, many times. As Supervisor Wilson said earlier, I mean, we're beta testing all of this, and it's pretty remarkable that we're keeping it together as well as we are. Supervisor Bone.
Since we're asking department heads up, and I know it's not on the agenda, but I know that probably our third or fourth most asked question that will have to be addressed is, what are we doing with property taxes? And since the tax collector's here, can he say anything, or can he at least say he's looking at it, or are we off the realm there?
That's a little off.
It's not.
Just have him bring it to the next meeting.
That's fine. Because that's.
Okay, so we'll bring that. That will be one agenda item. I
didn't mean to ask. I could have called that in. He's here.
Can we have the vote on this, or before we?
So are we no more? I believe we do have more staff over the phone. Oh, if we hear a ding, then we're so. Are you there, Director Mattson? Director Mattson, are you there?
Hello.
Hi, great. Good to hear you. Director Mattson, you have something to add to this discussion, this item?
I support the item. I'm not saying anything of concern, and I also support the board, all the board's actions they're taking to help us.
Thank you, Director Mattson. Any other staff on the line? Any other department heads?
Melissa Martell, Environmental Health, is on the line.
Oh, Melissa, welcome, Melissa Martell.
Thank you. I also support your discussions, and I wanted to give a little information if you need it on environmental health.
Please.
Are you there, Director Mattson?
Oh, my goodness, that's weird. That's a loop. Oh. Sorry, Director Martell or Melissa?
Yes, I'm still on the line.
Yes, we can. Go ahead.
I was just saying, I don't know if you heard me, but I support the activities of the board. And if you want, I could give a quick summary of what environmental health is doing.
Yeah, I believe that's appropriate.
Yes. Melissa Martell, Environmental Health, is on the line. Okay, I'm getting a strange echo, but I'll go ahead with talking.
So, Melissa, just give me 1 second here. I'm giving direction right now to anybody else who's on the phone to wait till Melissa is finished. And if you want to, you can mute your phone, please. Go for it, Melissa.
Okay. Environmental health, our office is closed, but our staff is working remotely. We're coming into the office as needed to provide documentation to parties that need certain files or so forth to encourage projects or permitting process. At this point, we're reaching out to provide service and support to those agencies that are providing support to vulnerable populations. We're helping them with food handling, safety guidelines, so that they can serve their clients in regard to safety around COVID-19. So that would be masks, social distancing, hand washing, gloves. And for the most part, we're just supporting them and affirming the good work they're already doing. Mostly they're taking precautionary measures in the field. That's what we're finding anyway. And as you know, restaurants are closed except for takeout and delivery. And if we have any problems with that, we are getting a lot of complaints from concerned citizens about seating in restaurants. And we will follow up with phone calls to those facilities to make sure that they're aware of the current rules and regulations. Same with hazmat. We're on call. We have an on-call number. We're 24/7 for sewage spills, hazmat spills, foodborne illnesses, anything of that nature. Are there any questions for me?
No, thank you, Melissa. And this makes me think that next time that we have a COVID-19 special meeting, we might want to have a report out from your department as part of that, rather than as part of this particular agenda item. Thank you very much. Any other comments on this agenda item? Okay, we have do we have someone on the phone?
Yes, this is Karen Paz Dominguez, Auditor Controller.
Thank you. Welcome, Ms. Paz Dominguez. Go ahead.
Can you all hear me? I can.
Go ahead, please.
Okay. Thank you for the opportunity to call in. I am one of the employees working remotely, and I do appreciate the opportunity to speak to you. I did want to share that in the Auditor Controller's office, we have created a job ledger code that will allow departments to track all of their COVID-related expenses
as they pay invoices. So departments are familiar with how to use those job ledger codes, and I sent it out a couple of weeks ago, but it is only good if people use it. So as soon as they enter an invoice to pay, if they attach that job ledger code, then at the end of a period, whatever, a week, a month, however long you want to do a study for, we can run a report for that code that was used and generate exactly to the penny how much was spent related to COVID-19. I also want to say that I'm very supportive in the policy here, the updated policy for employees, because we have been kind of just struggling with employees who don't have enough leave already and are, they cannot come to work because of, unavailable child care, or just they are in a high-risk category. So I very much appreciate the board taking that into consideration and offering them an alternative. With the Auditor Controller's Office, it's going to be the game changer for us is getting laptops. And I want to thank CAO Nielsen for facilitating the purchase of laptops for us, because we are an 11-person department and we have only half capacity right now. So getting those laptops and those VPN connections with IT will put us right back at fully operational, and I'm very grateful for that. And the last thing I want to share with you all is about paper checks. Our office will not be able to print paper checks very soon. We are prioritizing, or we're encouraging everybody to enroll in EFTs, that's electronic fund transfers, so that we can pay them. We're going to be doing 2 EFT runs a day. We're going to get as many payments out as possible for electronic fund transfers. The paper process is a very lengthy one to begin with, but now with the even less staff available to come to the office to print the checks, I foresee that we're not going to be able to maintain that service. So I would really like to encourage everybody who is a vendor, who is an employee awaiting reimbursement, to please enroll in an electronic funds transfer. And you do that by emailing ctyauditor@ceo.humboldt.ca.us with a copy of a voided check or a bank confirmation letter. Thank you. That's what I wanted to share.
Thank you very much, Ms. Paz-Dominguez. Supervisor Brown.
Ms. Paz-Dominguez, I certainly hope you are contacting all the vendors, letting them know to do this, and not thinking they're sitting here watching this meeting and doing everything in your powers. I just want people to know that you're doing that. I'm sure you are, right?
Yes, absolutely, sir. Every time that we print the check, a letter goes with it, reminding them to please sign up for EFT. I've also put it on our website. I sent email blasts to all of our partner agencies. I even put it on Facebook.
Thank you. Thank you very much. Any more staff members on the phone? Mr. Bartholomew, welcome.
Thank you. John Bartholomew, Treasurer Tax Collector. And just a report from our department. I realize that your board is getting many questions from property taxpayers wondering what the status is regarding needing to pay property taxes in respect to the difficulties surrounding COVID-19. And just as this office has always had the authority per our Revenue and Taxation Code 4985.2 to waive penalties and fees when taxpayers are in circumstances beyond their control, COVID-19 will also apply. So our office will be waiving penalties and fees for people that provide some kind of information regarding why they could not pay it relative to COVID-19. And there will also be an agenda item before your board shortly, which will be a resolution which will basically say that once the shelter-in-place order is removed, then there will be one more day for property taxpayers to come in to the office when we're open to the public to pay at whatever date that might be. In other words, if it's extended beyond April 9th, then we will have a day beyond whatever the ending day is for the shelter-in-place order, then we will have another day open to the public to make payments timely. And that will be an agenda item to your board for your next meeting.
So basically the message is the property taxes are due, but if you can't pay them at this particular time, you won't if you can tie it to the COVID emergency, you will not be charged fines or penalties. Is that right?
That is, in a nutshell, what it is, but we will need some documentation stating why they lost their job, the business wasn't open, they were sheltering in place, they couldn't access the money. You know, there's many different reasons, and I'm not going to try to specify exactly what they are, but we will have to have some kind of note and documentation which will specify why they were affected by circumstances beyond their control and had to pay late, just for our own documentation requirements for this sort of thing. But I fully intend to be waiving penalties and fees in most all circumstances. So I'll just leave it at that.
Can I just ask you very briefly, since we have opened up this conversation, to explain to people the cascading effect of not having property taxes on hand?
Thank you. That's a crucial question, actually, and I should have mentioned that. Many local agencies are dependent on the property tax revenue that is collected by this department, and if we did not collect it in a timely fashion, then there'd have a real cascading effect across many local agencies. We are subject to what's called the teeter plan, which means we have to distribute, well, the auditor's office actually does it, but it's 50% of all property taxes collected in December, and then 40% in April, and the final 10% in June. And if we were not able to distribute all of that money, the county is obligated to come up with whatever the amount is due to all these local agencies. And so without that, the property tax collections, the county would be under the gun, and then if the local agencies did not get their money, then we would not be able to pay such as school bond requirements. We've got 63 school bond debt service requirements that we're paying out on. So there's a huge cascading effect if we do not collect an adequate amount of property taxes so that these funds can be distributed into our local agencies so that they can continue their operations. Many agencies use general fund revenue, which is funded by property taxes collected for their operating needs. So this is a crucial component in how all local agencies function.
Thank you very much. Really appreciate it, Mr. Bartholomew. Supervisor Bone.
I'm looking at County Council. How open has this door been opened?
Close the door. No more discussion.
Yeah, because this needs to be on the next agenda for sure, because I'm looking at a different avenue. Okay.
Thank you very much. So again, duly noted, we've had a couple of board members now, Supervisor Bone, Supervisor Madrone, mentioned things that they would like to see us address outside of this agenda, and I can promise that we will have them on the next meeting whether it's a special meeting or a regular meeting, reminding everybody we do not have any regular meetings scheduled until April 17th at this point, or 14th. We have some public comment. We're kind of mixing and matching here, but that's okay. We're on different circumstances.
So I have one public comment from Thomas Mulder, who just called in, and he was very concerned that all the department heads are speaking and various people, because this was an item brought to the board by the CAO's office, and it was not agendized. And then he was also concerned that we weren't wiping the mic between speakers.
Thank you very much. Thank you very much. Appreciate that comment. Okay. No more comments from anybody. I'm bringing it back to the board, and we have a motion and a second. We'll do a roll call vote.
A roll call vote. Supervisor Bass?
Yes.
Supervisor Madrone?
Yes.
That was a yes. Supervisor Fennell?
Yes.
Supervisor Bone?
Yep.
Supervisor Wilson?
Affirmative.
5-0.
Thank you very much. So, oops. Is there somebody on there that we missed? Okay. Thank you. We are adjourned. And again, really want to thank everybody for your participation in this meeting. I'm going to turn this thing off. We will keep you informed as to whether we are going to have a special meeting or if we're going to be meeting on April 14th. But everybody stay safe, shelter in place, or stay at home, whichever you like to call it, and please remember those who are more vulnerable. Thank you.